past few years, as we've been moving through the COVID-19 pandemic, we've seen more and more people struggling not only with their mental health, but also trying to find the care they need. Last year, we heard reports that almost up to 50% of adults in the US suffered from negative mental health impacts related to the pandemic. To shed some light on this topic, I'm here with Tom Nix, CEO of Ria Health, as he explains how we can improve these outcomes and how a new California law could help. Tom, can you tell us about this new law in California, SB 221?
It's really focused on helping people that are looking for mental health or substance abuse care to be able to get access to it fast. And because of the pandemic really driving utilization and demand, it was really important, I think, for the California legislator, led by Scott Wiener, to pass this bill.
And with this bill taking effect in the next 5 months, which is fairly soon, what are you starting to see some organizations doing?
5 months is not a long time, especially if organizations have calendars that are preset and schedules that are preset, which most do. But I think the opportunity that could have the most impact is really coming up with an organized communication strategy that is going to consist of 3 steps. First one, really being able to understand the modality or the channels that are the most effective. So being able to segment the members that you have to understand which channel of information, which channel they're going to be the most receptive to, whether it's text messaging or mail or email. The second is to ensure that you have a coordinated strategy that's going to help reinforce all of the effort that's been done either directly by the employer contracting with telehealth services such as Ria Health, or the health plan partner who's been working diligently to expand the network offerings for their mental and substance use disorder treatment providers. And so being able to understand what the right modality of communication will be for the member, putting together almost a set of resources so that they can understand alternatives to brick and mortar providers that may be down the street from them, and then really optimizing all of that together with a coordinated communication plan so that you can get into the hands of the members, whether it's an email, a text message, a direct mail piece, information so that when and if they need support, they know they have some shortcuts through the existing tried and true paths to be able to find accessible treatment. And that, I think, really helps people maintain a compliance in the event of this new law. So I think those are some of the things that we're seeing forward-leaning benefit leaders do.
As you mentioned, or as we know, this bill is taking effect in California. How do you think this will impact other states?
We're seeing many states implement the metrics that are going to determine parity from the Mental Health Parity Act, primarily driven by the Department of Labor's request for people to start to report and measure on a couple of factors. And at a high level, what they're looking for is, do you have your physical health plan mapping in parity to your mental health plan when it comes to the number of providers per member, the distance geographically, having parity between where your physical health providers are located in comparison to where your mental health providers are located, making sure people that are in rural areas have someone who's within a specific distance. And then lastly, having the opportunity for people to get that timely care. And so California has led the way with the implementation of a law, specifically SB 221, focused on this. There are 5 other states that are utilizing a time and access to care in their efforts to enforce mental health parity. And we would expect to see more and more states adopt regulations around that time and access to care, because it is so critical and such a high demand that isn't going to go away anytime soon.
Thanks so much for sharing your knowledge on this topic with us today, Tom. We really appreciate it.